My name is Reagan Bartel. I'm the Director of Health for the Métis Nation of Alberta. I'm also a proud Métis woman who lives and works in Region 4 in Edmonton. My background is 16 years of critical care nursing before I moved into public health, taking on this role. And I'd like to introduce my friend Keith.
Hi, my name is Keith King. I'm a registered nurse as well, with also 16 years of experience, mostly working in public health and mental health and addictions. I'm also a Métis citizen. I'm Métis on my mom's side, and I'm an assistant teaching professor at the Faculty of Nursing at the University of Alberta, working in vaccinology with Dr. Shannon McDonald.
Thanks, Keith. So for those of you who are joining us today, Keith, it's a pleasure to have you. We're just going to talk a little bit today, a little bit about the COVID situation, which I'm sure you guys are all aware of, vaccine rollout in our province, and kind of a few of the questions that have come through our Vacci-Nation Talks, through my telephone and email. And I thought it would be great to have a healthcare professional here just to answer some of those questions so that you guys can watch them and share them and just have a space where you can get trusted information. It's a safe space. We're not here to push anything on you. We're just here to provide information that is grounded in evidence, primarily public health evidence, and that's relevant to our context here in Alberta. So I think that's really important. So obviously this pandemic has been going on for more than a year now, and we've had a number of phases. We're kind of going into the third wave. It's just starting now. So I think it's a really timely conversation to have about vaccinations.
Absolutely.
It's also really important to understand the context of all of these public health measures, because we're doing all of these things and sometimes it just feels like we're robotically going through the motions. And I think often we forget that there's a reason why we're doing these things. How do you feel about those public health measures? Like, how do you keep yourself motivated to keep up with them?
Well, I think, Reagan, going through phase one, or wave one, wave two, and now going into wave three of this pandemic, it's really important to keep in mind the ways in which we're keeping our community safe. So by limiting our in-person exposure to other people, trying to stay close to home, avoiding gatherings that are indoors, and sort of limiting those social interactions that are at high risk for spreading COVID-19, we're sort of protecting our community, protecting our elders, and giving time for people to get vaccinated. Mm-hmm. Wearing masks out in public. There's now recommendations around wearing 2 masks if you're in close contact with people outside of your home, and of course hand sanitizing and all of the different things that go with that. Mm-hmm. But yeah, ultimately we're creating space for us to get vaccinated, which will eventually lead to increased freedom of movement and being able to gather again.
Mm-hmm. I think it's really important for our community to remember that we do actually have, higher risk for severe outcomes related to COVID-19 amongst our community. So, we do have higher rates of diabetes, hypertension. We also really care for our elders. And, there are people in our community who are immune compromised. We have higher rates of certain cancers. We know that we have folks who are taking medications that might lower their immune systems. So for all of those reasons, that's how I continue to stay motivated, to wear masks, to be 2 meters apart, to do all of those things, to not itch my face even when I want to scratch, because I know that that is a way that I can protect myself and those around us. So I think it's a really Métis worldview to look at the public health measures that way, not just as an individual, but as what we're doing for our entire community. One of the ways that I like to think about essentially the public health measures is like a piece of Swiss cheese, and it's kind of called a Swiss cheese model. Google it, guys, if you haven't had a chance. But the reason is, a single piece of Swiss cheese has a bunch of holes in it. If you think about that as masks, okay, as a public health measure, if you just wore masks, the COVID can go right through those holes. But as we add different layers of public health measures, we start to see that the holes don't line up anymore. And the risk of COVID navigating all those holes is a lot harder. And so I think it's really important to remember kind of that model as we roll out vaccines, because vaccines really, in my mind, are just another public health measure. Does that make sense to you?
Absolutely.
Yeah.
And I think when you add those layers, the social distancing, the mask wearing, the staying home when you're sick, the avoiding indoor gatherings, all of those things together both as individuals and as a community, lead to much better protection.
Yeah, I think so too.